only agreed, but she also inquired if she could co-lead a presentation on reflex integration with none other than Sheila Fritz. And Sheila accepted. What a gift. So Sheila is an internationally renowned OT with over 40 years of experience. She created the therapeutic listening program and has trained over 15,000 therapists. She has authored and co-authored numerous books. So without further ado, we welcome Heidi and Sheila. And there's Diane Bales, who will also be monitoring questions at the end, so that then she'll be able to pick up the questions through the chat and put, so that there'll be a little bit more order to the flow. So,
okay, great. That's great. I think it might be easier to wait till the end, but I mean, if there's a burning question right at the time, it might make most sense to ask it then, but I find it's easy to get sidetracked if we have lots of questions throughout. So okay,
we sort of figured since we were stretched for a little bit of time, it was probably best to try to continue with the train of thought. And so if it's burning, write burning on the comment line, because then I'll identify it.
Okay.
Okay, thank you.
Okay, and I'm just going to start my stopwatch when I start so I can monitor, so I'm not like looking for my time here, and just I can be kind of wordy and talk a lot. So I certainly want to share lots of time with Sheila. So, okay, so I'll share my screen and then I'll make it bigger. Okay. Just give me 1 sec. I'm moving over everybody. I just need to manage. Okay, so hi everyone. I'm really happy to be here today. This topic, the primitive reflexes as related to function, is something that I've been really passionate about for a number of years. And so yeah, I'm really happy to share today. And actually, I forgot to do, there's not a lot of people on video, so I'm not sure how effective this would be anyway, but I wanted to kind of just poll the room here, the Zoom room. Are there lots of people who are currently using different methods of reflex integration in their practice? I just wanted to maybe get a show of hands. I mean, we don't have a lot of people on video, but are there a lot of people that use, just to kind of gauge? Okay, so I'm seeing like one, like a few. Okay, so a few. All right, so good to know. Okay. Okay, I'm just gonna move this back over. Okay. Okay, so here's an outline of what we want to chat about today. So I'm just going to do an overview of primitive reflexes, what happens if the reflexes are not integrated, as well as, you know, the significance of the different primitive reflexes. I'm also going to talk about a couple of examples that I think are applicable to most of us here in terms of anxiety-related primitive reflexes that I see a lot in my practice. We're also going to share more about our experience using reflex integration in our practice. And Sheila's going to do talk about expanding our view. So looking at a number of different areas, not only just primitive reflexes, but, you know, sensory systems and the whole picture in terms of the nervous system and what's going on. And then we'll leave time at the end for questions, because it's really nice to have a really good discussion. It's a really cool opportunity to further chat about this. So, okay, so I kind of gauge where people are at. So there's a few people that have some background in terms of reflexes. So in order to understand more about our clients and more about what's going on, we really need to look at development. We need to look at what happened when the child or the adult was a baby. Did they meet their milestones? What did that look like? We need to know more about their development in general. It's going to give us more information about the whole picture of what's happening with the person. So in terms of primitive reflexes are known to be automatic reactions to a stimulus. So when a baby's a baby, you know, often it's moving their head or it's response to a sound or different sensory input where the baby responds to that stimuli. And so for an infant, there's no choice in the matter. You know, if the reflexes are doing what they need to do, their body's going to respond. And for adults and children, we would ideally want to have the reflexes not present still, because when we move, we want to be able to have that volitional movement. We want to be able to move our, you know, our head independent of other parts of our body. And it's really about that more mature nervous system. So really the primitive reflexes are thought to be the basis of the whole body movement system. And if we didn't have primitive reflexes kicking in before birth and during the birthing process, as well as after birth, you know, for the first 2 and a bit years, we didn't have those reflexes kicking in, then we wouldn't have those normal movement patterns developing and the normal child developing, right? So essentially gravity would just be kind of keeping us there on the ground. So we do see this in individuals who have had different traumatic births and brain damage in utero and at birth. We do see that, you know, the primitive reflexes don't necessarily develop as they should. And so the primitive reflexes are going to develop into lifelong and postural reflexes, which will enable us to further develop and move like we should and develop all the necessary skills. So we can think about reflexes as a journey. So we do have nature and nurture playing a part here. So the nature being, you know, you do have to have, you know, a properly developed brain and the neurocircuitry and things in place in order to first develop the reflexes and, you know, have the reflexes do what they need to do and integrate. But also a big part that we can control as therapists is the nurture part, right? So what are the environmental experiences in terms of being put in equipment or being allowed to move about as you know, the baby wants to, and the different exposures to different stress or toxins, etc. There's a lot that we can do in terms of the nurturing to help with the reflex development. So in terms of the reflexes, they're thought to have a journey, right? So they're going to emerge, they're hopefully going to develop and peak and then integrate, right? But that's not always the case. So primitive reflexes are really like building blocks for the higher level skills and, you know, the ability to do things like, you know, speak, pay attention, develop more refined motor skills, balance, and really essentially everything that we learn to do. And so I really like this visual because we'd really like to build our nervous system and we'd really like to have that good foundation and that good development down below to help with our developmental progression, right? So on the left is kind of the optimal and the right is kind of, you know, they've got some things developed in terms of their staircase or their base for development, but they don't have everything in place and it's kind of rickety. It's not as stable. So I really like that visual. And there's a really great resource out of New Zealand by Robin Cox called Get Ready for School, the Foundation Skills for Formal Learning. And she has a couple DVDs that she's put out, which are really well done. And they show the different kids playing and they show different activities to work on different component skills. And also she talks a lot about how the primitive reflexes are really critical for developing all these higher level skills. So I'm sorry, it's kind of small there, but you see the reflexes are at the bottom, then you have the sensory systems, the different motor development components, as well as the auditory and visual skills, and then at the top, the reading, writing, and math, and other academic skills. So if you think about it, if we've got problems down below, then the higher level skills are going to be much harder for the child to develop. There's going to be, you know, stuff missing, so it won't, they won't be doing as well with those higher level skills. So we know that babies innately want to master their control of movement, and they want to move. And so, you know, a critical thing is really the baby needs to be on the floor. The baby needs to develop that head control primarily in order to help with future development, not only in the primitive reflexes, but the strengthening in regards to the core muscles, the shoulder girdle, you know, it all works together. So unfortunately, we often have these different contraptions for babies to keep them contained for whatever reasons. And I think a lot of us these days, it's really marketed really a lot in terms of, you know, we need all these contraptions for babies, but we really don't. We really want them to spend as much time as possible on the floor. So we all know about the FAR senses that we learn in school. And so the vision, hearing, taste, touch, and smell. And so, you know, we're interpreting the sensory input from the external environment. We're making sense of it in the internal environment. And then as OTs, we all know about the internal or the near senses, right? So the vestibular, the proprioceptive, the tactile, and the interoceptive input, right? So that's taking what we know from inside using our sensory systems. And Sheila certainly can talk a lot more about that. You know, we need those skills to develop in coordination with our FAR senses, and we need to, you know, make sense and integrate things. And so just to let you know that intrauterine reflexes begin to emerge really early on, so at about 5 weeks in utero. So, you know, really early on, things are happening, or they should be happening. And so really reflexes in terms of their goal and what they do for us is they really help us to move from one stage to the next. And so some can be thought of as transition reflexes to move us from, you know, lying to crawling, and different transitions in terms of movement. And so they all have parts to play in our development. So in regards to if reflexes are still retained or not integrated, if they're still present in the body and the nervous system, they can cause a number of issues. So we often get referred with kids with, you know, trouble with postural control, trouble with balance, you know, maybe they can't sit still, they've got a lot of attention problems, or they have a lot of emotional problems in terms of meltdowns, and they can't regulate. And, you know, coordination skills and eye movement skills are often kind of pain points that we see. And so really the proper development of primitive reflexes can help us with those higher level skills that I talked about before. So the hand-eye coordination, the concentration and focus, the general organization, the emotional system, as well as the regulation piece. That's a huge one as well. So some of the things that can cause problems in terms of the reflexes and not allowing them to integrate is, like I said, the nurture, right? So if the child is spending a lot of time in the bumbo seats and the, you know, the jolly jumpers and the playpens and baby walkers, etc., and they're in that upright position, they're really not getting what they should in terms of the development of their other sensory systems, right? If they had their head in that plane when they're, you know, on the floor and they're getting that rotation and they're starting to do the transitional movements and whatnot. So I really tend to discourage those things. I mean, I know they're the popular things. We all want these specialized, you know, baby equipment and stuff, but I really don't like them. And I feel that, you know, especially the jolly jumpers and the baby walkers, if you have the child, especially the jumpers, I find not only are they putting them in a position to strain their joints and to have problems later on with the, their knees and their alignment of their legs, but also, and their hips, but also they're really developing those leg muscles much earlier than they should. And that doesn't help them out, because they really need to have time on the floor, and they really need to go through the transition of developing the reflexes and having them do what they need to do in order to crawl, in order to do all those things to get them ready for things like, hand raiding and climbing and doing all the things that kids should do. So, and my sister-in-law, when I had my son, when she was asking what can I get you for, your baby, I said, I absolutely do not want a jolly jumper. I don't want playpen, any of that stuff. And she was actually quite shocked. And so, but I mean, I didn't want to do all those things because I knew the implications. So this is not to make people feel guilty. And so this is, you know what you know when you know it. And so had you not known, and you used all these things, I'm not trying to make people feel guilty. I'm just saying that knowing what you know now or will know in the future, they aren't the best things. So ideally, you would want as much time on the floor as possible. So when we think of babies and we think of different kind of aspects of how we can describe babies and what's going on with babies, we think about all those things, and then we think about, okay, well, how could we describe people with ADHD or ADD? Are you thinking that there might be some similarities in terms of some of the things that we see there? So you're right, there are. So I really like this example because it's really showing us that, it's really about the brain and nervous system, really. So all these symptoms of these different labels that we all kind of tend to want or get for our children, the symptoms or the labels, if it comes back to us thinking about the brain and what's the brain and nervous system doing, we can see the similarities. So then we can work on that. We can help with that through different activities. So if the nervous system is functioning at an immature level, we might see problems with motor coordination, with balance, with vestibular function, eye motor problems. There's a number of things that we see. And so sometimes reflexes fail to develop as well, or they fail to be integrated or retained. So integrated and retained are the same thing. So they're still active in the body. And so there's also heredity, disease, lack of movement experiences like we talked about with the nurture. Maybe there's toxicity, or there's various types of trauma that happened, or even prematurity, and C-sections can affect development. And so I really like this visual as well. So the individual might look pretty good on the outside, they got they look generally pretty good, but then when you look closer, there's something off, right? So we need to look at what is off. So in terms of the goal of reflex integration, well, we want to integrate the reflexes so that they don't affect our volitional movement and what we're able to do. And we want to really build the neural pathways. So we want to get the brain linked up, from different parts of the brain, from the brainstem to the higher brain, from the cerebellum to the front of the brain. We really want the frontal lobes connected as well, because we don't want the individual going right into that primitive defensive response, right? Which is the brainstem, right? They're functioning from the brainstem at a lower level than a lower neurological level than they would if they had, their frontal lobes on board. They were able to think about things, and if the limbic system, the emotional system, didn't want to kind of take over things. And we also want to create those postural foundations and stimulate the senses. So it's a number of things that we're doing, and Sheila will talk more about that. in a little bit. So just to give a couple examples, so the Moro reflex you've probably all seen, especially if you've had children. You would have noticed when your baby was a young baby and there was a noise or a sudden change in movement, the baby's going to have that rapid response of the body. So the body's going to go into a flexion response, their head's going to go back, they're going to start to cry. And ideally what we would want to see is have, you know, a caregiver nearby to provide them with that that flexion, that integrating movement to flex the system, to provide the integration of the Moro reflex. So if it's still present, we might see a number of things. We might see that the person's sensory systems are overly sensitive. Maybe they have motion sickness. Maybe they don't have the proper pupillary response to light, so that when you have light, their pupils stay dilated instead of constricting like they should. They might have trouble with auditory confusion, right? So there's really a lot of trouble deciphering from background noises to what's going on right in the present moment. And in terms of the Moro reflex, we might see a person who's under constant stress and anxiety. Maybe they have a lot of mood swings, they're really moody. They could be quite hyperactive and then just totally just be wiped out, because it takes a lot of energy to have this stress response happening. And a big one too that I see oftentimes is the need to control things, right? Because change is hard, change is stressful. And the fear paralysis reflex is a reflex that actually is developed and should actually integrate in utero, and then it transitions into the Moro reflex in utero. So this one, this one, along with all of the reflexes, can come back on later in life in times of stress or if there's an injury, etc. So the fear paralysis reflex is thought to be a withdrawal reflex. So withdrawal from touch, and it's a protective reflex. So often these individuals will symptomatically show problems with difficulty with change, extreme shyness, feelings of overwhelm and stress, low tolerance to stress. They have really a really limited window of tolerance in terms of sensory input or new situations, etc. And this one with the extreme shyness, I always like to mention that if you know people or you have clients that say, oh, they're extremely shy, and from birth, it's like they were born and they're extremely shy, and it's just chalked up oftentimes to being a personality thing. I don't feel it's a personality thing. I feel like it's the fear paralysis that's paralyzing them. Like they can't get out of that, because normal, quote unquote, human behavior, human development would say that we want to be social with others, we want to engage, right? So the extreme shyness on that extreme level, I don't feel like that's just a matter of personality. So in terms of my, I'm just going to check my time. Okay. So sharing my experiences related to primitive reflex integration. When I first started years ago in working with children, I was just kind of noticing that, you know, the children would make some changes in terms of what we were working on, but I felt like there was something deeper, something else that needed to happen, because really they weren't making these leaps and bounds in terms of progress. So what happened is I was searching for other foundational programs, and I came across Sheila's therapeutic listening approach, which I thought was really cool, you know, getting at sensory integration from the brain level. And also around the same time, I started learning about primitive reflexes and the significance of primitive reflexes. So I went to my first 1 and 2 workshop in, I think it was in 2009. And it was quite funny. So I I spent some time at Camp Avanti in Hudson, Wisconsin. So Camp Avanti is a special camp for kids with sensory processing disorder. And it was founded by Patricia Wilbarger and her daughter and a number of other therapists, but it was a really neat experience. So I participated as a practicum OT to learn. And anyway, it was quite a nice model in terms of the camp. There was a sensory diet incorporated into the campers' day. And there was also therapeutic listening twice a day that the campers did. And anyway, it was a really great experience. And so I don't know what I was thinking at the time. So I did the week and a half at Camp Avanti. And then 2 days later, I drove, in the meantime, I drove to Ohio and I did my first rhythmic movement training 1 and 2 course, which was awesome. But anyway, my nervous system was really like wiped out from all this information and experience. But anyway, so a long story short, when I got back home and I started using the work from the RMT in my practice with my kids that I was seeing, I started seeing pretty significant changes and more changes than I'd ever seen before. And I was actually able to start discharging kids from my caseload because they were actually making such progress and they were testing out of the average range. So anyway, so that's kind of my thing. And then, so from there, I thought, I really want to bring this to Canada. I really want to educate other OTs because this is a huge thing. So yeah, so these days I'm not working a lot with kids these days, but I'm still really passionate about, passing the baton and trying to, plant the seed with other therapists. So I'm really happy that Sheila was able to join us too. And yeah, so I'm gonna pass the baton to her now.
I'm gonna share my screen really quick. Okay, so thank you, Heidi. You did such a beautiful job looking at the reflexes. And just to give you a little bit of my history, I just want to say I'm a grandmother now, so that should tell you something. I feel like a grandmother as an OT as well, because I started my journey in occupational therapy really passionately involved in trying to understand the work of Dr. Jean Ayers, which is so broad in terms of brain development, really, from the perspective of the senses. But I also was learning from an NDT standpoint. So really what Heidi said, really studying development of movement in depth, along with development of how sensory integration affected the brain's ability to learn, as well as the child's ability to behave. And so at that point in time, we did really look at primitive reflexes. Now, Dr. Ayers looked at them relative to how well you were integrating sensory information. And I'm going to say to date, I use them as a guidepost in treatment. And I see them as part of a bigger picture. So, and I feel like you really did say that, Heidi, from the perspective of the reflexes. So I think I'll go from the perspective of the big picture. So we're really just saying the same thing in 2 different ways, but they really are part of normal development, and they emerge and come into the foreground. So that would be where they're active. And they serve a certain purpose, if you will. And when they were first being brought to the world of OT, they were coming from the work of McLarty, who was a neonatologist out of Italy. And he was being brought to the US with people that studied NDT, neurodevelopmental therapy, a la the BOBAS. Okay, I know sometimes people say NDT meaning reflex integration work, but so that they were looking at these patterns as emerging to serve a certain function. So if you take the fear paralysis that Heidi talked about in Moro, those functions are protection. So the baby, when they're born, is just getting used to gravity. So take the Moro, which often people say is about the fear of falling. So if the baby if their head goes back, or if you're in a diaper change, sometimes you lift their bum and their arms would fly out. Why? So the first part is the arms would fly out and open up as a means to get them ready to grab a hold. It goes with the grasp reflex of mom to hang on, because that's all they can do. And if they don't get a better grip, to curl up and in a ball to protect the soft underbelly. And Heidi pointed out, and I'm going to come back to talking about this and what she's calling fear paralysis reflex in a little bit here. I'll come back to kind of winding things together with those patterns. But so another pattern that you can think about that is a reflexes that many of you are probably aware of if you've had a baby or have taken care of a newborn is the rooting reflex. So where if you touch like this side of your mouth, the baby would root the mouth toward the touch, any of the 4 quadrants. So if you touch the baby up here on the lip, they'll put their head up here, their head will turn there, their head will move down. Why? It's an aim to what? Get the lips to the nipple, right? To orient the head toward the food source. The interesting thing about this emergence and retained reflexes, I don't use the word retained, it's just foreground, background for me, and they come forward in need and they never go away, they go to the background. And I think that the retained word for me got me confused when I came back to studying reflexes again. So I like to think of the foreground and background. I think that's more accurate. So what's true though for the baby is if they're not hungry, they won't root. So it serves this certain purpose. They're not really like a knee-jerk stereotypical. They're really there to serve a function, to give you sort of the rudimentary aspects. So in rooting, it's to get the head oriented towards survival first, which would be feeding. And actually in the rooting, another part of, and things take, I think of sensory as stimulating the reflexes into development. So you have to have that touch to the side of your mouth to stimulate the rooting, right? Reflex. So just thinking about sensory triggering the patterns and that they would then come forward to serve a certain developmental purpose. And then once they are matured and serving their purpose and other things come in to support them, they will go to the background. So they are going to combine with other patterns, combine with other reflexes, if you will, and recede to the background as a support. So I don't know, did you guys have lunch yet? Because this is kind of a fun thing to do, to show you how the rooting really helps with orientation of the head. So what I'm going to invite you to do is to just take your head and turn it and find a point behind you, turn it both to the right and the left, and see where your eyes land, and do that a couple of times. So you can raise your hand or just say it in your head. Did you have a stickier side? Even if you watch me, this is my stickier side. So if you haven't just eaten, you can now try to play with seeing if you can use the reflex, because it still supports head orientation. So for me, I'm going to do this as I turn my head. And what I notice is my eyes land a little farther, that the rotation was easier. So I sometimes like to think about the reflexes as the keyboard, you know, on the piano, that you can play them, that they don't really go away. They're there to support this one, head orientation. So, and that head rotation. So you can use them, and it's well integrated when you can use them in other ways. Did that happen for anybody else? I don't know where you can put that in. It did? Good. Okay. Yeah. It's a subtle thing. It's not a big deal. But you can see how they live in the background to support function. And I think that's, to me, and I do have to say that some of my biggest training in reflex integration and my perspective really comes from the work with a well-known OT in somatics and just a whole nother world of somatics and embodiment named Bonnie Bainbridge Cohen, who actually worked very directly with the Bobas and was around at the time of Margaret Rood and Jean Ayres and was one of their contemporaries, but she has gone off to teach in the world of somatic experiencing, somatics, dance. She works with dancers and actors, and you could go to a Bonnie Bainbridge Cohen workshop and have anyone from any walk of life come up. I was there once, and there was a man who was studying the history of the development of the chair at Stanford, was at one of her workshops. It's quite an experience, but Bonnie really started her work in the roots of her early work as OT. So anyway. So key sensation and sensory inputs support and trigger the emergence of the primary, I like to call them primary movement patterns, because reflexes, people think of it's there, it's not there, kind of knee-jerk kind of piece, if you will. I like to think of that foreground, background, and that their primary movement patterns as Heidi already showed us, the stair steps are like that foundation, the building blocks that we build on, that we move off of. Bonnie Bainbridge Cohen calls them the alphabet of movement. You know, you need all of the letters well formed, and then you could put the letters together in a word, and then you could put them together in a phrase, and then you could put them together in a sentence, and then you can put them together in you know, a blog, but then you could put them together in a research paper. They would come together differently that way, right? And then you could put them together in poetry, and movement is like that we use these patterns to support movement. And I want you to think of movement beyond motor skill, but also that there's many movements that we make to express ourselves emotionally that they support. So we use the perspective of the primary movement patterns to gain insight. That's how I use them, into integration of key sensory systems and to guide treatment from an embodied perspective. And I actually use a lot of, if you want to call it reflex integration techniques, embedded in a sensory integrative context. And I like to call them power-ups. Like I just use the rooting. Sometimes I'll use a little power up. If a child is only turning their head to one side, I might take a puppet and kiss them on one side with the puppet to get them to scan in the other direction. I might use it as a power up. I might see it where it is, as people call, retained and getting in the way. And then I will, knowing what's underneath it and what comes after it, work toward. I loved your emerging and developing and going back, but just try to work that whole arc that Heidi was talking about. So, and that for me, assessment occurs within a larger context of OT, the sensory motor foundations for higher level skills, identifying areas of occupational performance and engagement that are impacted. And when I'm working from this lower level, I'm always looking to see, are those higher level skills coming clearly into focus to support function. So treatment entails both, for me, precision of activation of the key sensory systems that are associated with the pattern, and then facilitation of what I like to call the kinetic module and the quality of movement connected with that pattern. And I put in a video here, so I want to see if I can't move a little quicker to get to it, because it really, I think, personifies how we approach reflex integration, or how I do. And it's interesting, we do teach a course called Building Blocks for Sensory Integration from the primary movement perspective, which, you know, Heidi has that in there in her slides. That's exactly how I see them as well. So Heidi talked about fear paralysis. In the literature and in the psychological literature, people talk about fear paralysis. In the world of trauma, people talk about fear paralysis. So I think of fear paralysis as more of a psychological term, but in the world of fetal development, people talk very much about the hardwiring of the nervous system. So then you're going to, those reflexes that Heidi talked about that developed early, that go into fear paralysis. The acoustic startle is one of them, and the tactile withdrawal reactions. And so that's what starts to develop at 5 weeks, is touch to the baby's head. The baby's going to move away from touch. They're going to pull their head away. They're going to pull their limbs away from touch. And then a loud sound outside of mom's belly around 9 to 12 weeks post-conception will cause them to curl up tightly in a ball. These patterns also have, and that's what's interesting about your shyness withdrawal, they also have a component of autonomic nervous system function. And the only component that is developed, or the component of autonomic nervous system function that's developed first, is sympathetic, increased heart rate and respiration, and the vagus nerve is starting to develop its primitive function of slowing the heart way down for protection. So as if you took an infant and dropped them into a pool of water, they would go into this dorsal vagal withdrawal response and their heart rate would slow way down, and it would protect them from actually drowning. Okay, so sometimes people call that the diver's reflex, but all of that terminology is about this early survival value of the autonomic nervous system. And then as that emerges into the moro, you get more of the sympathetic protection. So basically, those early reflexes are all about withdrawal and protection of slowing down function and tightening and pulling away all of the flexors on the front side of the body that are vulnerable. The moro happens at birth, where you have this opening up and the baby takes their first breath and they turn on sympathetic firing in the opening of the body. And as they exhale, that's when they get the parasympathetic branch of the autonomic nervous system that's mature, that's about regulating sympathetic firing. So you can think of this as the gas and getting them ready to act outward. And then when they return from the moro into this softening pattern, they exhale. That exhale functionally slows the heart so we can attend. So that really, those patterns, if people call it fear paralysis into the moro, are all part of our hardwiring of our basic autonomic nervous system and how it intertwines with the parts of our brain that are perceiving safety and danger, as well as the parts of our brain at the highest level that help us orient outward. And I wound that together with a little polyvagal theory, and it's probably way too much for now, but I just wanted people to see how there was a bigger, broader picture. And then I have a video here, but I want to make sure and just look at the time. I just want to check really quick to see if there's any questions for clarifications, because I think sometimes when I pull things out into a bigger picture for people, it gets more confusing. Like when we look just at the reflexes and we think of them in this basic way, it's easy to understand. But the truth of the matter is that when you go to treat in your clinic, you have to pull it back out into the functional picture. So I'm just going to see if there's any questions really quick for me around what I'm saying before I show a video, because I think that I can help solve some of that hopefully with the video.
Sheila, it's Diane. I don't see any questions on the chat.
Okay.
One that just came
There's
in.
one that was just posted there just now.
Okay, I don't have it.
You
But
scroll down. I can read it out.
okay, thanks. I don't seem to be on the right chat, I guess. Okay.
Or it might be scroll down. So Sheila,
Yeah.
Miranda has a question. So would you use patterns of reflexes to move people up the ladder of regulation? For example, would you try to use flexion to move them into safe and social, or am I understanding it wrong?
Yes, no. And that's exactly what I'm going to show you. So no, you're not understanding that at all. You're not misunderstanding. So what you need to first understand is where they're at and why. So thank you for the question, because I think it helps to clarify where I'm going. So you're going to meet this little guy, Henry. This is a longer video, but it's a really nice progression. So what you're going to see is a synopsis of a 2-hour evaluation session with a little boy with autism who came to me, speak of controlling, as Heidi said. He could, and rigid, he could only do what was on the calendar, and he knew everything in terms of getting around in space. He knew how many telephone poles to the 7-Eleven and how many telephone poles to school. And when you think about telephone poles, unlike trees, I'm in the Midwest, they drop their leaves, and when they do, it changes the sense of the space. Even if they get white snow on them, they don't look the same, but telephone poles, they stay the same. They don't change, they're always there. So he needed everything to be exactly as it is. And when you look at him, he is a young man who all of the reflexes aren't integrated. But if you just honestly look at him, he looks like an infant that you just sort of propped up. He's sitting back on his tail, and you're going to see him in the beginning, and he looks up at me and his head goes back and he goes over and then kind of catches himself. Right there, there's a little sequence of tonic labyrinthine, Moro, but he's really gone away. Nobody can connect with him. He doesn't talk to anybody. He does rote behavioral kinds of things. And I'm going to tell you, I want to show you the whole of this video, but you would all leave the meeting because I spent an hour with no connection with him whatsoever. And, you know, I was thinking, and people were videotaping me. I was about to have a heart attack. Like, I'm supposed to be some kind of knowing something OT. I don't even want to call it anything. And it was a disaster. The room was a mess. Bubbles were spilled. Toys were everywhere. And I couldn't get a simple back and forth. And you'll see a little bit of that. It's painful for me to watch it. And it isn't until, and so you'll see this point on the ball that looks like nothing to you, but you have to realize a whole hour went by where there was no exchange between him and I. Nothing that wasn't scripted. And I take him onto a ball, and what I am thinking, so I love that you said that flexion response. In the withdrawal reactions, the flexion response that's going on is phasic. Think about if something was a bomb went off, you'd go, and you would hold really tight. So flexion that is organizing and that calms us is tonic, okay? And in that phasic flexion, which happens in, if you want to call it fear paralysis, or the withdrawal reactions, acoustic, startle, all wound up in the nervous system in the same chemistry, is that you're holding your breath. You can hear that in his voice. When I take him onto a therapy ball, and I drape him over it and I elongate his spine and give pressure in and say 1, 2, 3, 4, 5, and then I lift my hands, which is the sudden movement. So I'm really playing with the withdrawal piece. So I'm giving him this chance to have the emergence of the next phase, which is the Moro. I'm letting go of the breath. I'm letting go of the tension patterns of the holding. And you know that the Moro hasn't emerged. So if we take Heidi's graph, and she's got those red lines of emerge, is Moro, this part where his arms come out for protection and balance hasn't even emerged.
Yep, that's mommy's water. Here, you put your shoes on.
Oh, somebody else's microphone is on, sorry.
Yeah.
Now, hopefully this makes sense. And the reason you know it hasn't emerged is because when I take his head and move it forward on the ball, he should put his arms out to protect himself. Protective extension, do you see how I'm using the patterns to give me more information about him and then to play with moving him up that ladder of connection? After I do that and say 5, he says to me, more, I just about fell over. Like, we're having an honest conversation, and then it just started to play from there. And what I know about, if I could get his tone to relax, get him out of that freeze, and use the vestibular system to ground him. And I use vestibular input that's very stimulating because I want him to get the sense of, whoa, opening up the body so that he can close. And you'll see that I play an edge there with him where he's like, he's getting really high arousal, but then I bring it back down and I ask him if it's okay. And every time, every point from those ball boings, I have a connection with him. And I do have to say, we'll watch the video in a minute, but I can't stop and narrate it. It's too choppy. Is at one point he crawls on the pillows and I turned and Mom was crying. And I didn't know why she was crying. And she said to me, you know, because I looked at her like, what? And she said, he's never crawled in his life. I didn't practice crawling. It was an emergence. The other thing is that when I wound him up, I'm going to wind him up in Lycra in a little ball like this. And Mom says to me, moms are so intuitive. She says to me, you know, he was a twin and he was draped over his sister, so he never got to go into that pattern. So I like that you picked up on the flexion, because that tonic in physiological flexion is that tonic flexion in utero that allows you to feel that deeper tonic, what we call the flexion patterns as being calming. So anyway, that just, it's kind of all over the place, but it's all tied together in the patterns and in the sensations. So let's take a look and then we can do questions. So I'll go ahead and play that. Hopefully it plays after that big intro into it. I'm not sure if I need to go forward one or, let's see if that works. Oh, somehow after all of that, it is not playing. So,
do you have it posted somewhere, Sheila, that people could watch it maybe at a later time? Or
well, here's what we could do is I will, if you, I can send the link to, we don't like to post things publicly, but I can send the link to the organizers, and you guys could send it out to the participants. I think that I can do that.
I think someone's saying, I think the slideshow isn't in play mode. It just looks like an image instead of a link.
Yes, I know. Somebody set this up for me, so I'm not,
Yeah.
so I wonder.
There's link.
Yeah.
Okay, click on that.
Yeah, Tracy did this yesterday from my office, so unfortunately I'm technically challenged, so.
Anybody else have any advice to help us out? Where's Katie? Katie, where are you?
We could do this. Let me just see if I can get Tracy on the phone and pull up a link on my computer from somewhere else, and I will back out of sharing my screen. And Heidi, if you want to take questions, would that be helpful, or would it be more helpful to send the link later?
Manira is saying play the video on your computer and share that.
Right. I get that.
Okay.
It's just a matter of, I'm not sure where it is on my computer because we work off something that's called Mac Shared. And so I just need to quick phone a friend to figure out how to do that.
Okay. Are there any questions that people would like to post in the interim?
So let me stop my share for a minute while I do that and mute myself.
Okay.
so does anyone have any questions? I also have just some ideas of things. So Sheila has various courses on her website that you can check out. She can speak more to that. The method that I teach, Rhythmic Movement Training International 1 and 2, right now they're doing an online version of 1 and 2, which is about 10 hours of theory that you do within 30 days. And then the hope, and then it's followed with 2 hours Zoom with an instructor to answer questions and review the content. And then there's a 2-day practicum that kind of goes along with, if you've done the one, well, it's not a 1 day, but if you do the online piece, then there's a 2-day practicum that can follow, which is the hands-on skills and whatnot. But I'm not sure how that's going to work in terms of COVID and restrictions and whatnot. In terms of the practicum, who knows?
Okay, Heidi, I do have one question. It's from Isabel, and she's asking, can reflexes be integrated, or I guess in the background, and then re-emerge due to childhood trauma and come back into the foreground?
Yeah, most definitely. So any of the reflexes can come back on in times of stress or trauma. And so, and like Sheila was talking about, it's kind of like a fluid kind of thing. They can emerge. So for example, if you have whiplash in a car accident, you have, there's trauma to your neck, a lot of the reflexes are thought to be kind of housed in the brainstem, right? So it would not be uncommon to see that, some of the reflexes still come back on, as well as in later life, when you see the elderly and they start to get that forward flex posture and they're having balance issues and whatnot. If you think about that functionally, when they move their head, it's affecting their posture, it's affecting their balance, right? Which would be the tonic labyrinthine reflex. And there's probably other ones that are coming back on. So yeah, for sure.
Okay, thank you. Another question about ongoing education. Is the practicum for rhythmic music training in the States or Canada?
Well, so if you look at the website, there's instructors all over the world. It depends on the restrictions and ability to travel and whatnot. And so for me, I'm in Sault Ste. Marie. It's not really overly feasible, it's not feasible for me right now to travel to the GTA or to travel to other parts of Ontario because of the COVID problems, and because when I come back, I need to self-isolate for 14 days. But not only that, when you're in there and you're trying to teach a course, there's people coming from all over. So it's kind of, I guess I would say, maybe higher risk in the sense of COVID. So I'm not comfortable traveling, and it actually probably wouldn't be the best use of my time, especially with restrictions, like you can only have 5 people or whatever. So
Okay, thanks.
Here are some other books that I really like. If you're looking for more foundational resources that talk about development and talk about the nervous system kind of important components. So these are just some examples. There's so many different books and resources, but these are ones that I really like. I'm sure Sheila has other ones that she likes as well.
Okay, thank you for those. Any other questions? Well, we've got a little bit of a gap here. I'd love more ideas of how you commonly use reflexes in treatment if possible. That's from Leah.
So Sheila would be a great one to talk about this, because she actually has a clinic where she has, a great sensory gym, and she's able to do a lot. When I used to work a lot with kids, I would bring so many different kind of sensory things with me. And so there's different ideas from different sources. So the Billy Ann Cheatham, the physical activities for improving children's learning, and there's various other resources, have some really great ideas in terms of play and incorporating reflex work into play. But yeah, and with the RMT, I mean, there's a variety of different movements that we teach. So passive movements and active movements, which are doing different things in terms of linking up the brain and the nervous system. But certainly Sheila would be much more of an expert in terms of using her sensory gym, and using, the question was about incorporating reflex integration into play and stuff.
Okay.
Well, I got that up. So, and it's exactly what I'm doing with the ball boings, which is considered a reflex integration activity when you do that. So that would be like my power up. And it really was the window into connecting with Henry and then understanding where he was at in terms of reflex development, where he was in this withdrawal place or fear paralysis, and then moving him into the Moro is what it integrates into, because the Moro allows us to reach out and open up to the world. Really, this posture I'm doing right here is what babies do when they're distressed to seek help, instead of just collapsing into themselves, which is a progression upward, if you will. So let's see, I went backwards and found it on our private YouTube channel. So hopefully I can get this to play if I reshare my screen here. So let's see.
I don't know. Are people able to stay a little bit longer, or what's the Zoom organizers?
You can go longer. I can stay on, but anyone that can't stay on is welcome to. But if they have work, then.
So I apologize for that. It was a little technical error in my playing, and this is the faster way for me to show it. So I'm going to show this video. If you have to go, and you can drop us an email, we can get you a link to that. So, and then we also discussed this, as Heidi was pointing out in our course, Building Blocks for Sensory Integration, is how to pull this all together into a sensory integrative perspective. So here's Henry.
Henry, come over here.
So I'm just going to pause for a minute and point out a few things, and I'm going to fast forward. So I'm trying to connect with him, and I pick up a letter. I try to put it on my finger. I try to make it interesting. It doesn't happen. But although I'm starting at the very beginning of that, those defensive reflexes, the fear paralysis withdrawal, trying to move him up the ladder, you can see his whole postural system is not well developed, right? To be able to look up at me, he lifts his head. When he lifts his head, he loses his balance, right? And then he has to be able to look down, he has to bring his head down. He can't move his eyes independently of his head. We also know this is a vestibular related issue. Postural ocular has vestibular proprioceptive at its base. And where we look for that is along the spine, head, neck, and spine integration. So there's a number of reflexes, tonic labyrinthine, ATNR, STNR, that go with that have not been fully developed for this young man, nor have they been integrated. So we're starting to, by watching him move and having the frame of the reflexes, we can get clearer about where we're at in the developmental ladder and what we need to do. And I may just push this along, because you guys already know that I was frustrated for an hour and most of the session looked like nothing was happening. Like in my mind, I'm thinking, why are these people paying me for this?
And that's really nothing else because
And I have another therapist who's come to do a practicum, which of course, you know, makes it even more intense that nothing is happening. So I tried to put it on my finger and get it stuck there, so he at least had to interact with me, and he tried a little and then just gave up and went back to his own little world. The closest I got to any connection, but not of quality.
Okay. 1, 2, 3, 4, 5. Point. Okay. 1, 2, 3, 4, 5. Point. More. Okay. 1, 2, 3, 4, 5. Point. More. Okay, we're gonna do like this first. 1, 2, and then we'll do it. Okay.
So when arms don't respond, the arms get wired in with the Moro
Okay,
pattern.
ready? Here comes the 1, 2, 3, 4, 5 point. Here goes. 1, 2, 3, 4, 5 point.
And Sheila, maybe if you want to comment too about how when we're looking at children, we can tell that things aren't developed just by how they're moving or not moving, right?
Absolutely, absolutely. And I was trying to kind of narrate that. And then if you think about, this is a reflex integration activity because I am giving him, so for me, it really spoke to clarity in sensation. He needs vestibular, but he needs it with clean, clear proprioception, particularly down the spine, like all the way down the spine, especially that Moro's at about head, neck, and spine, because it's about the baby experiencing sudden change in movement. So it has a proprioceptive element. So I'm giving him that, but it's graded. Here's what flexion felt like, and now you're in the same position. Oops, a little movement, right? And it feels good to him because it's graded. So, you know, right now we're not seeing it in his arms and in the movement, but we know it has a whole autonomic sequence to it, which the withdrawal would be so much parasympathetic that you're withdrawn and shut down. And as sympathetic starts to come online, you use parasympathetic modulated with parasympathetic for connection. And that's where I got the connection with him. And now, if we talk in sensory integration, now I have a lead to follow with him because he wants more of the ball and he's liking intense vestibular. And so that's the lead I take with him from here.
5, 6, 7. Okay. 1, 2, 3, 4, 5, 6, 7. Boing. 8, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Boing. 11. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Boing. More. Okay. How many? Should we do 5 and boing? 3 5 and boings? Yeah. Okay.
And remember, everything was scripted until then. Now we're really having a conversation, simple, but more than anybody's gotten out of him that wasn't a script.
1, 2, 3, 4, 5. Boing. Okay, we're gonna do some of these and then we'll do some more boings, okay? Let's do 10 of these and then we'll do some more. 1, 2, 3, 4, 4, 5, 6, 7, 8.
So Sheila, there's a couple questions there.
Okay.
One question was, what are we looking for on this ball?
Okay. So one, what was I looking for? You mean at this point in time, I'm looking for protective extension. It's just not there. Do you call them saving reactions, parachute reactions? They emerge once the Moro is integrated. So I'm often looking at arms to tell me about the protective responses. And it's more about the tonal qualities and the reactions of them versus what you're doing in a motor skill. So you also look at that to say that his vestibular postural system was not well developed and that his balance system is not well developed. But he spent his whole life withdrawn here. So we're really kind of taking him back in sense to the sense of what it would feel like to be in utero, although I'm going to play with the intensity of vestibular with him in that curled up pattern that he didn't get.
Whoa. Oh my goodness gracious me. I thought so.
And I'm going backwards because that's the plane where you feel like you're falling. I want him to open his body to the environment, which would be this first phase of the Moro. That's thinking of it in it, what it brings to us.
So Sheila, another question. Are you using I think it's spinal pressure on the ball to integrate your paralysis?
So if you can imagine, if you have a friend or you get on a ball and a friend first connects with you, I'm using a downward and a traction response. So you could feel that that would put a little stretch on all the little muscles in between the vertebrae. And also what it does is it gives pressure on the abdomen, which helps you exhale when you're holding your breath, so that you can then inhale into a surface, a deeper breath.
So she was actually asking, are you using spinal parese on the ball?
I don't know what that is, sorry.
So that's a reflex.
I wasn't thinking that. You know, maybe I was, but that wasn't what I was thinking. I was thinking about curling his body up and giving him that sense of what we call more physiological flexion. Like, so when you're born, you have physiological flexion and then you open to the world. So I was recreating the sensation that would trigger the pattern.
I need to tell you, Sheila, get it. 8, 9.
So it seemed like, Sheila, you were going with his safety of feeling the flexion, which is his safety, but you were also trying to promote that nice extension, and which he did show some lifting of his head a little bit, and you're trying to bring him out of that through using safety through movement, right?
Right. I'm giving him, so I just want to say that all all of the reflexes give you the affective piece, give you affect. Affect is the sensory motor, the movements we do for emotion. And so when you think about if you're really upset and you withdraw and you don't breathe because you don't want to feel your emotions, for him, that was the place he lived in. You can see that expression and connection with another is not there. So these early defensive patterns are intertwined with all of our social emotional development, but it's at its most basic level, the felt sense of it, and the most basic physiology. So it's like we're going way underneath the skill. But since I'm also working with breath and the vestibular system here, I'm in the very basic components of developing posture. It's almost like he has to rewrite the story because those building blocks didn't completely emerge. That's how I see him. It's not that they're in the way, they didn't show up because they didn't get the right sensory input to trigger them. So now they're not there in the background to support you. So I think that's the confusing thing. And I hope not to confuse you. I think Heidi did such a clean, clear job, but I also want to put in some of the muddy, erase the boxes, because that's the reality when you go into treatment. And when you get the really big picture and you can tie all of your skills together, then you get the big bang in treatment. So, I mean, I can go on with him just a little bit here, what we kind of did in the Lycra, and just talk about, let's see, a little further. You've seen some of this.
Sheila, I have another question. When you are looking at a child like this and they have their moral reflex that hasn't fully been integrated, and you think of that general timeline between 3 to 6 months that it should start, would you extrapolate that to the other reflexes that should have been integrated at the same time, or is that not?
When you're talking about, and Heidi already pointed this out, when you're talking about withdrawal and moro, they can show up due to traumas and extreme stress. And so my guess is when I go back into the world and we're doing building blocks and we start testing therapists for moros, we're going to see a lot more of them because we've all been under extreme stress and we're all lacking the safety of being with each other and the other things that help us. It's minimized by what's going on. So they can be pulled out. Those postural reflexes are really part of the whole sensory motor chain. So Dr. Ayers looked at tonic labyrinthine that's what she was doing with prone extension, supine flexion, looking at how you deal with gravity. And she did look at STNR and ATNR in her original clinical observations because they have to do with postural ocular issues. And she looked at postural ocular, how it was underlying visual perception. So they're and they're at that bottom level. So it's like sometimes it's hard to grok what you're doing because you're going down to like as high. I like the staircase, those bottom stairs to get them solid. And sometimes what you find, so for Henry, after this session, he was different. He shifted and we gave him some home activities and he requested them. And he would bring the ball to mom to do those ball boinks. So you're in when a child asks for it. And it seems like this silly thing that we're doing. You're stretching him over the ball. Why are you doing that? So I think that this is just the bigger picture of where you can go once you learn the building blocks. And you start out at that basic level learning the building blocks, and then you put it all together. But I found when I came back around to reflex integration from, it kind of went away, and we looked at it in a really basic way back in the 1970s. And so when it came back around, it came around like a new thing. And I was like always perplexed with trying to wind it together. And really, the course I teach in building blocks is my culmination of trying to get you to see the big picture and start out of the gate that way. And it doesn't, we actually use a lot of rhythmic movement training and concepts from that work. And it's been very helpful. So to me, it's the bigger picture that I'm always interested in. So, and I don't know that I need to continue to show the video. I could if people want to stay for the last couple minutes of it, or we could just take more questions. What's the group poll say?
I think
we still have 63 people on board.
We'll play the rest of the video and then Heidi and I can come back and answer your questions. I kind of wanted to get to this next activity that I use a lot here.
15, 16, 16.
You need to get to the other
See,
micro that-
Yeah, see, I'm like right here when
No, I just want to get.
the therapist that was with me just starts this bouncing and counting, nothing's happening.
Let's go.
Do you see, like he's kind of whatever. I want his engagement. I want him to want the activity. I want his body to light up.
There we go.
So I'm trying to get him into another lycra where we can roll him up, get him in this tight flexion, and then when it unravels, he gets the surprise. So I'm going after the same pattern a different way. And when I get there, he loves it. And you can see he asks for more and he's interactive again. So I'm using his affect and his connection with me as a guide to when I am waking up parts of the nervous system.
Can you climb on it?
So let's see if we can get there. There. So this is the part where he crawled and mom was crying. She's like, he never crawled. Well, it's not contralateral, so it's not mature, but it's there.
Well, I like him just climbing through all the little stairs. Like that's the way he should be doing space right now. There's a lot more feedback.
So I'm just saying to mom, I want him to have vestibular, but I want it to have a lot more feedback to his body. Instead of just putting him on a swing where he's sitting or riding a bolster swing, for him, yeah, that'd be some great vestibular, but unless you did a lot of handling for posture, it wouldn't have the same therapeutic benefit.
Yeah, no, do you want to spin is the question.
And he says, do you want to spin me?
I like to spin.
Right, and the point, Sheila, too, about the dynamic movement, right? Because if you have the consistent, regular movement, the nervous system is just going to just say, oh, that's not new. I'm not interested.
Yes, yes. And the novel pieces so that you have to continue to adapt. Exactly. And it's like, what intensity? We also know vestibular wise, I'm really looking to animate his arms. And we know that that's connected through rotary through the vestibular. So I'm like weaving back and forth between my sensory information and what I know about the reflexes because they unfold together.
Yes, this is the opposite one. Oh no, this is what's your normal way? There you go. There you go. You can still lift. Okay, do you want to stop her? Ready, set, go. Oh man.
But can you see the quality of connection with us? It's a back and forth. It's seamless. It's not prompted. It's not scripted. It's not like trying to pull something out of him. And it's in the moment. And to me, that was the best part of all of it. Like I was having fun and he was having fun. We were getting to know each other instead of just, and you have to work the edge. Some people would get worried, like, was I going to too high arousal? But no, he comes back.
How about you push me over and then a spin, okay? Push me over and then a spin.
So just using push through the feet is something, and I don't know that it's a reflex per se, but babies do bracing, foot bracing, very grounding. Very much getting the center awake to bring his breath down. So just thinking about these really early patterns and what they give us. So that was Henry. So hopefully that was helpful in all of that. So thank you so much for dealing with my technical issues, which have gotten better. I think during the pandemic, I've been forced. People used to just walk over to my computer and do everything for me. But now I've had to do a little bit more on my own, but I did have to phone a friend for that one to get to our YouTube channel. But thanks for being patient with me. I really appreciate the support.
Thanks for joining me today, Sheila. I think that was amazing. And I think probably a big message that you had just said is just, start, like, start learning stuff, start, you know, like take some courses, and certainly what you do in your practice is amazing, and you integrate so many things, and it's maybe somewhat daunting because it's like, oh my gosh, like what to do or whatever. But even if people just start, right, and just start
Right.
with the stuff, you know, I think it's a good start.
And I didn't start there. I think you have to just continue to wonder and be curious. Would never tell you I knew everything, or when I meet a child, I'm sometimes like, I don't know. I'm just going to wonder, could it be this? Could it be that? And every tool you use, don't throw out an old one. If you've learned how to use a tool, wonder how they work together. And for me, it's not about deciding ahead of time what my client is, or by a diagnosis or whatever, but just really going in with open eyes. And for me, the reflexes or primary movement patterns really helps me read in the moment where somebody is and support them in the moment. And it gives me a thread, so that fear paralysis in Demoro takes you into vestibular proprioceptive. If you were stuck in that fear paralysis, I might go to sound because it's so wound up with the acoustic startle. For me, that's how I do it. Somebody else might do it with relationship because that's their strength. And I think that's the other takeaway, that you have a lot of skills, you know, just keep building on them. And you'll have different styles of people that you're attracted to the way they do things and how they talk about things. Go with what feeds you and what speaks to how you think and learn, and like who you resonate with as teachers. That'd be the other component I would say to people.
That was great advice, actually, for especially newer therapists who are very much overwhelmed. So that's very good advice. Thank you very much.
There was
Yeah.
still one question from Rowena. I'm just trying to see if there was one or there were two. Actually, Ro, are you there? Do you want to ask it? It says something like, I think of the normally developing child having a better ability to accommodate for patterns rather than the child who is neuroatypical.
Yes.
And yeah, and then I think there was another question from her somewhere.
But I'm going to say that a lot of the patterns can be completely blocked from development by, particularly Heidi hit on this, the container culture. I am telling you that I am seeing kids, lots of kids who don't have protective extension. I'm at a baby shower. I'm not supposed to be Sheila Frick, the OT, and this mom is talking about how her child that's 18 months old keeps getting knots on his head. And I'm like sitting there going, it was at my son's wife's shower. I can't be the OT. They get mad at me for this. I can't interrupt here and have a lecture. And finally she said this, but nobody can tell me what's going on. I couldn't stand it anymore. I'm like, he hasn't developed protective extension. Why didn't somebody tell you that? And then I said, what does he look like? Do his arms come out when he falls? No. Well, here's what you start. These are the games you play at home. So it can help it happen. And you're going to see it more and more. And I pray to God that we don't keep changing the damn norms so that protective extension doesn't exist anymore, or that you balance, I don't know, you have to go to 7 classes to learn to balance. That's what's going to happen if we don't really keep supporting normal development, and it's going away. Playing football and soccer at 3 is not it. That's going into skill. It's about natural movement, and it's being removed from the environment. I'm a little stronger on that. Both of my newborn granddaughters have gotten $600 Boundexes, which are these like huge, it's instead of suspending the playpen, the Lycra from the air, it goes on a frame so that you have the Lycra hammocks. I'd say if anybody did anything, find out how to get Lycra into your practice, because it replicates the floor, because it's no longer fun to lay on the floor and pick up your head. If you didn't learn it there, and it's easy to stand up, even if you didn't learn head control down on the ground and kind of balance it. But those are the kids whose eyes don't work together. So you have to make it fun. Think about what the baby does, but don't imitate it completely.
Okay, so on that note, so Rowena's also asking, are reflexes or early movement patterns integrated or accommodated for as development and age sort of continues along? Do you like ever skip that reflex when they're like 13 or something?
But if you do, there's a ramification somewhere, and it could just turn out to be a knee injury, a hip injury, an ankle injury. So Bonnie Bainbridge Cohen worked with dancers. And so think about this affective, emotional piece. They're trying to transmit a story by their movement. And she found that a lot of their early development wasn't completely developed, didn't completely emerge, didn't completely come to the foreground. And she said that every injury that she knows has underneath it a reflex that is not well developed or integrated. So it might not, like the Wall Street Journal, written by, mostly, the male perspective, that doesn't have to be men, but that perspective of intellect and mind without body said, oh, you don't really need crawling. We're going to remove it from the developmental milestones. That is a nightmare. So yes, you might be able to go sit somewhere and be a cerebral cortex, but it's going to have a ramification of how you move in the environment. And in some way, it's going to play out in your quality of life. So to me, the fullest development of human potential is what we're really all after, especially as OTs.
Okay, well, thank you for that. You are very passionate about not skipping a milestone.
Sorry.
Does anybody else have anything before we wrap it up? There's lots of people that have signed off, and we still have quite a few aboard, so that's terrific. Thank you for a wonderful presentation. That's come through many, many times. And so, Daph, do you want to wrap it up, or?
No, I'm going to pass it on to Paola.
Okay.
I'd like to thank Sheila and Heidi. Thank you so much, Heidi, for your inspiring thought of coming together as a team. You built a team, and calling on Sheila, and you brought so many people, all of us together, to share on how it is that we can bring our skills to bring the most out of these children. And thank you, Sheila, giving us those eyes to see and tweak our brains as well. So thank you very much. So I'll be, Heidi, I'll be communicating with you as well through Messenger to make sure that all of our back and forth, we've got it all done and all clear. And thank you very much. So we look forward in 2 months' time. So if you enjoyed this presentation, then please do not hesitate to join the OTPT network. And through our website, send us some thoughts of further guest speakers or whatever, especially in this virtual time. The sky's the limit. We got Sheila with us all the way from Madison, Wisconsin, right?
Mm-hmm.
So
today I'm in Omaha, but I just want to take a brief moment to thank Heidi for inviting me to join all of you. I really appreciate her spirit of generativity and really, opening up for lots of ideas. So thank you so much, Heidi, and all of you.
Great. It was awesome. Okay, well, thanks everyone.
Thank you.
Bye.
Bye.
Bye.